Hi everybody, this is Dr. Deb from Serenity Health Care Center. So fall is upon us and some of you are really happy and some of us are pretty sad that summer's coming to an end. But with fall comes Breast Cancer Awareness Month. So I'm going to talk to you today about a technique that you can use to identify breast cancer 7 to 10 years prior to you even having the diagnosis. Yep, 7 to 10 years. So we all know that mammogram is the gold standard for testing and diagnosing of breast cancer, which then leads to breast biopsy, of course. But you know, there is a way that we can look at an inflammatory response that occurs in the breast tissue 7 to 10 years prior to breast cancer actually being detected. And that's by using breast thermography. So breast thermography is a heat-censored picture that we use to actually take a picture of the breast. It's a digital picture which shows us hot spots or inflammatory spots that occur in the tissue. Now we can use thermography to look at any part of the body, but in today's talk we're going to talk about specifically breast health. So when we look at a thermogram for breasts, we're looking at myofascial tissue, which is the tissue between the layer of the skin. We're looking for an inflammatory response that occurs in the breast, and then we're actually looking for a hot spot in the breast. So any of these conditions that occur can give us tools to say, hey, something's happening in that breast tissue and we need to intervene before disease actually sets in. Now, by the time we look at mammogram's already diagnosing something, and breast MRI is even better than mammogram because there's no torque compression, there's no radiation, and it's going to detect something many, many years before mammogram. So let me tell you a story about a client that I had who was diagnosed with breast cancer. She was a 5-year survivor and was getting ready to do her next mammogram, which they found something on that mammogram. And they said, you know what, it looks okay, it's a little suspicious, let's look at this again in 6 months. Well, she decided not to wait that 6 months, and she decided to come in and have a thermogram done. And that thermogram showed an abnormal spot in the breast. She was really concerned with her history, so we opted for a breast MRI over waiting for a mammogram. And the radiologist contacted me and asked me, why did I choose breast MRI over another repeat mammogram? And I had told him, you know, she had this mammogram, they wanted to wait 6 months, we did thermogram, it showed a suspicious area, and I felt breast MRI was a better option for her. He told me at that moment that I most likely saved her life. With that breast MRI, they found a very aggressive form of breast cancer, which had she waited that 6 months to get the mammogram done, she most likely would not have survived for that breast cancer. You know, it's really important for us to be aggressive with our diagnostic tools, be aggressive with what we know to be true, even if it doesn't fit the gold standard. So that gal is still alive today. She's doing great. It's been 4.5 years. She still uses thermography as a tool, as well as mammogram and breast MRI as a tool to make sure her breasts are healthy and safe. So, you know, we're asking you to do what's in the best interest of your breast. If you're interested in seeing what's going on with your breast 7 to 10 years prior to seeing any kind of disease, you want to look at breast thermography. We offer a great breast clinic the month of September that includes myofascial treatment and teaching you the technique to do that at home on your own, along with breast thermography. We also offer a discount on breast thermographies for the month of September and October for breast cancer awareness. So give our office a call today if you want to use this diagnostic tool to help you find any kind of inflammation and treat that before it becomes a problem. Thanks a lot.